Hi. And that'll enable us to share this with others who maybe are doing other things at the moment, but will want to be checking in. And so as we get underway, there's a couple things I just want to say. You kind of have a setting of how to use Zoom. If you have questions, don't hesitate to hit me up. The other thing that I would note is we're catching you at a really interesting time. We just had a really large piece of legislation, maybe the largest economic stimulus package ever, go through the Senate yesterday and land on Jared's desk sometime in the middle of the night. So I want to note, and this is true for us here at the Chamber because we're getting a lot of questions as well. What's in the package? What's that look like? I think there's even some confusion that the Senate vote was somehow the final vote. And so I would just name in the context of this call, the House and Jared here will be making a vote on that tomorrow. I think a lot of us are working fast and furious to get familiar with the final details that went into what was essentially a third major revision. And I cannot imagine how many minor revisions went into that. And so while we absolutely would be grateful for and welcome any points of interest or things that you are looking for in that legislation, there is no expectation for you or your team to have memorized it or to be able to answer all of the questions that might come. And so I just want to set that as the standard because I think that's fair. And that the real intent of this is to let folks who are joining us who might have had either recent changes to their own employment status or as business owners made changes to their employees' employment status, to really have an opportunity to connect with you directly and for you to be able to listen to what's going on the ground and for that to inform the work that you are doing in DC and remotely just down the street at the moment. So with that, I would say welcome. Thank you so much for joining us. And you're welcome to start by sharing anything and I'll monitor questions and we'll keep the conversation going until we're out of steam.
All right. Well, thank you so much, Shannon. I appreciate this. Thanks to all for joining. I see some of you, like I said, I suspect I know most of you. This is a tight little community. So I want to preserve the majority of time for your questions. The listening aspect of this is more important to me right now. I understand there's a lot of uncertainty going on around the entire state and the whole country. Just take a moment to go online and look at the graph of today's jobs report and just see the very stark, graph of what rising unemployment looked like during the Great Recession of 2008 compared to what just took place last week. And in some ways that is, it is out of, it's by design. That is government action in response to COVID-19. As I was describing to some business owners who called me directly yesterday, we've put a tourniquet on an arm, so to speak, and cut off the blood flow to it, and that is causing all of this economic disruption. And so obviously it's necessary government intervention, which is also going to require necessary government economic action to try and help until we can take that tourniquet off. So in regards to the Senate bill that passed last night, yes, it's 900 pages long. And we got the text first thing this morning, probably about 5 a.m. So we are digging through it. I do have some sense of what's in it and can answer some of your questions as best I can. It will pass the House almost certainly tomorrow by voice vote, unless someone decides to request a roll call. It's within their right to do so. And it is the largest economic stimulus ever passed through Congress. So I take it very seriously. I'll be heading down to Washington to speak about it, because while I think there's some very good provisions in there, potentially, if we follow through the right way, there's some things in there that concern me as well, and should you. In addition, anyways, even in the event of a roll call, it would, I'm sure, get the support it needs to pass no later than Saturday. But that, look, it's still going to be several weeks before this money and other programs being stood up, like loans for small businesses that could become forgivable if they maintain payroll, help them maintain payroll. It's going to take several weeks. So it's going to, I think, be a tough couple of weeks here. And I encourage you to reach out to our office in Lewiston, Bangor, Caribou, if we can be of any help, even helping you understand what steps might be available to you. Now, we did pass legislation on March 14th dealing with unemployment insurance, anticipating that this was going to happen as a result of COVID-19. So we did make some, first of all, got some extra money to states to make sure that they had unemployment insurance reserves. We made clear who should be made eligible that wouldn't under normal circumstances. And now also, in addition, with the stimulus package that should be going into law, we'll be increasing the benefit by an additional $600 on top of the normal benefit, because we recognize that unemployment insurance is not often enough to replace the full wage that's been lost. So with that, just as an early, I think, kind of primer, why don't we go ahead and go to questions, Shannon?
Yeah, well, and as folks maybe start to get ready about what questions that ask, I'd note one of the things that we saw as a provision in the legislation that came through last night that is, I think, different than the, or in addition to the unemployment insurance bill, was provisions for sole proprietors and contractors. And there's been kind of this national movement in the labor force in general to move, a lot of folks have moved to contracting over the last couple of years. And so was grateful to see that in there. We have a number of sole proprietors and contractors within our membership. And I'm interested to see how that is. The other thing that I'd note for folks who maybe didn't have the opportunity to join us on Tuesday's call is something you said then that I think is really paramount to where we're at right now and where we'll be tomorrow, Saturday, and beyond, is that 90% of this legislation is really going to have its impact in implementation and not in the way it was written in law. And so, just hearkening back to what you had said there, because I think it's an important note. There's a fantastic question from Stephanie too, which is a little bit lengthy, so letting you get a chance to read that as we get into it. Go ahead. Oh, I'll read it out loud because I know some folks are joining just by phone. So there's a question on how the potential stimulus package will or could impact professionals. 45 folks had to be laid off on the 16th, all who work with clinical and educational positions. Getting them off unemployment and back on payroll would help, but there is a worry about the wording of the stimulus package that may exempt employees or businesses because they were already laid off and collecting. I think this goes to the timing question that we had some dialogue about the other day. There has been rumor, or it is heard, that the stimulus package would help those to stay on payroll. Does this feel like a legitimate concern?
Thank you, Stephanie, for the question. And I'm sorry for the situation you and your employees find yourself in. I know you and your organization and the work you do, and I know that the folks that work for you love what they do. They love the service they provide, and they would prefer to be working. I think it's a legitimate concern, and what I'm going to tell you right now, unless one of my staff jumps in and says otherwise, is I can't tell you 100% what the situation is. I can tell you that early on in the drafting of the provision, we had heard that it was the intent to have this provision for loans to organizations like yours to help them with payroll would be retroactive to March 1. So I don't know what the technical details are in regards to eligibility for someone in your situation. I also think that the drafting of this bill, look, people have worked very hard in the Senate to try and draft this, but the reality is, I think, at times some of these provisions are going to be a little bit vague on the specifics and open to the rulemaking process, which is going to have to move very quickly. And so I think Congress is going to have to be working together with organizations like yours to communicate congressional intent to the Small Business Administration. I do believe it's the intent to include organizations that have already had to lay people off, unfortunately, back to March 1. I don't know the specifics. I've thought about this already. What if you laid off 45 people and you have an intent to take advantage of this program to try and bring them all back on, but maybe of the 45, 5 of them have already moved on, and you can't bring them back. What does that mean for you? Because the intent certainly was to encourage business owners to keep everyone on payroll. So I can't answer your question in full, other than to give you a little bit of hope that my understanding was the intent was to open this up to people in your situation, but the devil is certainly going to be in the details. And please reach out to our office and the rest of the delegation in the weeks ahead so that we can try and help you out.
Sorry. Thanks, Stephanie. We appreciate your response and appreciate you asking that question, as well as the services you and your valuable staff provide. We know that that's a tough time. It sounds like maybe you were getting some back information. Is there anything?
Yeah, just letting everyone know. My staff is taking notes, so we will automatically follow up with you as long as we know who you are and how we can contact you. And Stephanie, we know who you are and where you're at.
Want to give an opportunity for others to ask questions. You're welcome to type it in the box or take yourself off mute. I've got a question that is coming up that affects the chamber, and not just the chamber, but other 501c6 organizations. They're recognizing, and this is reflective of our membership, there's a significant amount of folks who are working or employed or run not-for-profit organizations, and in there's a number of C6, C3, C4, C5 designations. Did you find out any more about the language around identifying nonprofits or not-for-profits in the bill? I know that might still be unknown to you.
I'm gonna, while I'm saying this, kind of look to see if Will jumps on to provide any additional clarity, since again, we just got Will, I see you just unmuted.
Yeah, so unfortunately the answer is I haven't actually confirmed this yet, but I know we've been in touch with Shannon about this question, and so it'll be on our list to confirm.
Great, thanks. We've had other folks ask that question, Will, so I'll make sure I get the word out once we know more. And I know that's one of the things that are in flux.
Yeah.
There's also someone joining by phone, 207-740-2613, who unmuted. Is there anything that you'd like to ask the Congressman?
Yes, hi, it's Betty Ann Sheets. I have heard from a lot of people who've been laid off and are applying for unemployment, and they're very appreciative of the ease with which we've made that, no waiting periods and things like that. But by being laid off, they've also lost their health care insurance. What recommendations do you have for them?
Great question.
Yeah, that's a very good question, Betty Ann, and I'm going to make sure that my staff follows up with you with like maybe something like more formal in writing, so that we could get the specifics. But there is some talks about trying to have like an enrollment period open up for the ACA marketplace for people. I do know that I think there was some discussion, and I would ask my staff to follow up with specifics about whether or not we were going to make eligibility standards a little looser for states that wanted to try and get people into Medicaid. Certainly when it comes to COVID-19 response, we did make clear that states could use Medicaid dollars for things like doctor's visits and testing, so that people don't have like an economic incentive to not go to the doctors if they think they may have symptoms of COVID-19. We've increased the federal share, I think, by like 6% to states under Medicaid to try and offset the cost of that. So that's all I've got for you right now, Betty Ann, but we'll follow up and see if there's any additional specifics in this stimulus, because there are sections related to healthcare.
Wonderful, thank you.
I'll just jump in quickly. This is Will from the Congressman's office. I believe that in existing law, if you're laid off, that generally triggers eligibility for ACA marketplace sign up if you're within that qualifying income range for subsidies. But there may be more provisions in the bill that, as the Congressman said, we'll have to find out.
Yeah, it looks like 60 days from the day they lose their coverage to apply for a new policy under the Affordable Care Act. And this, of course, would be often a better option than using COBRA, which I think people are familiar can be pretty difficult, financially in terms of the costs.
Yeah. Will, when you're following up on that, could you make a note of what financial provisions were brought into the bill that would increase the subsidy amounts, either the amount per individual or the amount of overall funding that went in to shore up subsidy supports? I think those are two related things that would support at least some projection of the implementation, because I think those are related.
Yeah.
Sure. So the subsidy for the state Medicaid program was in the second bill, and that is mostly about helping the state shoulder the extra burden. So there's not necessarily a direct pass through to the individuals on there, but will just prevent states from having fiscal problems from the increased demand.
Great. That seems like the first step.
Betty Ann, I think you must be familiar with Maine Consumers for Affordable Healthcare, who have specialized as a, under the Affordable Care Act, we set up organizations whose sole mission was to connect individuals and business owners with the ACA marketplace and help them better understand the most affordable option for them that also kind of matched best with their healthcare needs. And so right now, I would say that probably as a state rep, I would be reaching out to them to ask them, if they're gearing up to play a role here, because I'd be shocked if they weren't.
That is where I have been sending people, but you're right, I haven't reached out myself to find out if there's more that they could be doing.
Thanks, Betty Ann. Other folks who either want to type a question in or take themselves off mute and ask a direct question? I would also say this is a listening session. We would love to hear, and Stephanie's already done this, but how is this affecting you and your employment status for either yourself or your employees? What are things that are front of mind for you?
Or what are you seeing on the, at work? How is this impacting the daily operations of your business place? What kind of concerns do you have about workplace safety or about logistics supply? Anything at all that you can share with us so that we're aware of what some of the surfacing problems are is helpful.
I'm going to give folks a second, but I can also bring forward some of what we're hearing too, Jared. Anyone on the call want to unmute themselves? Just a reminder, you're probably on mute. We'll need to take an action to allow us to hear you. So I'll name one. We have a fair amount of blue collar operations within the chamber, contractors and construction who have been deemed essential. I think what I'm seeing, and this is true, my partner is himself an electrician working on a site that is close to opening a number of units of affordable housing, and we're going to need more of that. So I can certainly see how it's all interconnected. The very definition of a construction site means that they're likely without water, and that's true. There's a site here with 6 different contractors and trades on site, 60 plus people. And there is no source of water, and they're down to 1 porta potty with sanitizer. And so every day when he's going to work, and the steps that he takes when he comes home is front of mind for me. And I'm hearing from our members who are trying to adapt to what a 6-foot distance looks like when you're 2 plumbers under a sink. So I think it's the reality of what safety precautions looks like, and how we also ensure that folks are shoring up essential infrastructure. And so I'd be curious if others are experiencing that or share those concerns, and what you're hearing and how that plays into kind of the supply chain logistics that we would all want our healthcare professionals to be prioritized in, but of which there are many other folks, food service workers and grocery store clerks who probably should be having masks as well. And how does that all play out?
That's very helpful feedback, Shanna. I guess I would say that, from my perspective, I hope that businesses are proactively taking steps to try and protect their workforce, and being flexible and making what changes they can to do that. So, figuring out how to provide a greater than normal distance in places where people are working normally, more closely together. That kind of 3 to 6 feet standoff. Some people are going to have to be flexible, and if they're not, for workers, I would say people should not hesitate to advocate for those changes to be made. It's not selfish. It's not thinking about yourself. It's thinking about the entire community. Any efforts that are made to protect yourself really is protecting the entire community. The way that this spreads, ultimately in communities is through pretty tight networks. So I think the greatest risks of transmission are at the job site and then from there back home. Really, I think insisting that companies are thinking proactively about how to take steps to make it safer for everyone. If you are in that category of essential, businesses and services, is necessary for the entire community, and doesn't matter. I guess I would encourage a work site like the one you're describing, Shanna, to reach out to the governor's office to make them aware and ask them for even the slightest bit of assistance. As an example, can we get some help with getting hand sanitizers onto these types of job sites? Might be a reasonable ask, right? Truck drivers I was just talking to were saying, we're handling some of the goods that are moving around, particularly test kits, some of the important healthcare, PPE and other things. And they were asking that once all the healthcare professionals and first responders have masks and gloves, maybe the truck drivers could also have them. Because they're concerned. And I was pointing out to them, they should be asking for those things now. We do want to prioritize our healthcare workers and first responders, but if truck drivers start, if our supply chain fails, then it's going to fail for everyone as well. So workers should be absolutely communicating what their personal protection needs are.
Yeah. Thanks. We'll try to find a link to put in our community resource page at LA Adapts for that, because we have heard a lot of concerns about employee safety, and I think trying to know where the outlet is for that. And I think Mainers are proud, hardworking people, and so the last thing they want to do when they know someone in the healthcare industry is sound like they're whining or asking for too much. But I think the point that you're making is not just a really valid one, but a really important one for people to remember, that essential workers have revealed themselves in new ways through this crisis. I think we'll all look at our grocery store clerks and our post office folks and our Amazon delivery guys and gals with a different level of respect for how essential they are to our daily lives. And so those folks should be thinking about their workplace safety as well. So we'll do some research on the best way for folks to connect and make sure that's an available resource.
Yeah, another thing I would say to workers and businesses all around the state, Shanna, is I've had some conversations in the last couple of days, particularly the last 24 hours, even since you remember when we did the call on Tuesday, I think it was, that some people from the main manufacturing association were starting to think about how they might be able to stand up production lines of personal protective equipment for healthcare workers and others. Hearing people, workers, employees have a lot of skills, institutional knowledge, and just kind of know-how. So people should be thinking creatively and communicating. Is there a role that we can play as well? And then obviously trying to coordinate any efforts like that through the governor's administration to try and figure out what we can do as a state to try and become as self-sufficient in the production of protective equipment as we can in the, let's say, 4 to 6 weeks ahead, because you know, we're lucky right now, but in places like you know, as I talk to my colleagues in like New York City and others, what they said is, if I were you and I had a window of time, I would be focused on trying to figure out how to get the medical supplies, protective gear that you need for your healthcare workers first and foremost now, before you find yourself in a situation where people are going without it. So, you know, I'm encouraged to see businesses stepping up, but certainly it wouldn't hurt to have more people asking if there's a creative way that they can get involved as well.
Yeah. We have a good news local story where that exact thing has happened. Sazerac Bottling has brought 190 proof alcohol by the liter to the city of Lewiston and Auburn. It's been delivered to Bedard's Pharmacy, Medicine Shop, and to Central Maine Medical Center, where they're now manufacturing on site the hand alcohol sanitizer gel that's needed, and they're really starting to ramp up production. But yeah, we definitely have a lot of manufacturers of paper goods and plastic goods, and I think
some
thinking
textile
about how
people.
we shift that.
Yeah, textiles and fabrics. I mean, this is making masks is absolutely something we're capable of doing here locally, I would say. They may not be the N95 masks, which are preferred, but you know, there's a point at which something is better than nothing.
Yeah, I think that's right. Anything on that sheet of paper you need to bring up, or just taking notes? Okay.
Taking notes, although
Okay,
my
good.
staff did want me to reiterate, if people have concerns, questions, either now or they come in later, reach out to us. We are in you know, kind of full-blown outward-facing constituent service you know, mode here. So we're here to help, whether that be helping people with unemployment enrollment, helping businesses as they gear up to try and connect with the SBA about what's the programs coming out of the stimulus package. You know, we are kind of focused 100% on helping the community in the weeks ahead. So keep bringing.
I know you've got Will on the call, and I think that he's even at a computer. Will, feel free to type into the chat box preferred email, websites, or phone numbers for people to be using. And that chat gets recorded as well, so we'll have that there. I'll also type in laadapts.com is a site that we propped up in pretty quick response and are constantly updating, and added to it today or later today is 2 Q&A videos filmed by SBDC about how to work through the SBA loan program. The other thing that we're noting for folks in state is to work directly with your financial institution you already have a relationship with. That's how the FAME funds at the state level are getting rolled out, and it's the best way for you to kind of find your starting point for seeking funds. Thanks, Stephanie. Yeah, Stephanie just noting that she'd love to hear back about some of the services that she's providing and some of those questions getting answered. I have no doubt Congressman Golden's staff's been really quick with that. I made a commitment to make the most of this time for each of us as well as for Congressman Golden. And so I'll give about another minute for folks to identify questions either in the chat or by unmuting themselves. And if we aren't going to, then we're not just going to sit here Oprah style. We'll let the congressman get through that big bill that he's got to look through before his rather long commute. So any other questions from folks that are on with us currently? I'll give you guys about a minute more before we part ways and say thank you for Jared's time.
We wait, Shannon. Let me just say, you know, we talked about how the implementation of these new assistance programs for small businesses are really going to matter. That we can't just pass a bill and say that's it. It's really the tip of the iceberg, and the devil's going to be in the details. But I'm on the House Small Business Committee. My staff has a relationship with those committee staff, and all of them with the SBA here in Maine and nationally. I think that you know, Shanna, I've worked in the last year to reauthorize the Small Business Development Center programs. And as a result, have really gotten to know the SBDCs all around the state. And in speaking with the governor's chief of staff this morning, mentioned that we should be trying to pull together a task force of people to think how we can streamline the process of small businesses, trying to reach out in the weeks ahead. The SBA is going to be, I think, facing an unprecedented amount of outreach, and they only have so many staff. So to the degree that we can all also lend our staff support in trying to assist small businesses with the application process and making sure that they're getting it right, crossing their T's, dotting their I's, and that when those applications get to SBA, they're in the best condition possible so that they're very easy to, hopefully push through the process, is something that I think we should all be thinking about, how we can work together over the next, 4 to 8 weeks until this is done. So
on that front, there's two things that I think you and your team can be advocating for, paying attention to in the implementation process. We here at the Chamber do have a number of loan pools that we revolve, and we, currently just offered a 90-day forbearance to 29 loans across 16 different local businesses. And one thing we're noting is, we were able to do that because of our own reserves, and that was a decision we were able to make independently. But a number of us, AvCog and other institutions like ours, have clients, and I'm looking at some of the language that came through in the bill. There's some language in there for federally backed mortgages to hold interest, but we don't have that flexibility both in regulation and in finance right now to do that and extend that to ours. So I think the two things I'd be paying attention to is where are there already funds that exist that are not being deployed through these stimulus packages but are being held, and how could the regulations make the new rules apply to pre-existing funds, and what guidance and supports can you, I think, there is a triage system of how folks can get supported through these processes. So identifying ways to train and shore up those of us who have the capacity and supports to support that process as it rolls out, and to be thinking creatively about what that looks like would enable us to be part of the solution as well. So I think two things just to pay attention to as you go through the implementation and rulemaking process.
it's very helpful. Thank you.
Yeah. Absolutely. There's been a couple of thank yous in the chat box. Elaine, it was a pleasure, and I'm glad that you could join. Betty Ann, anything that you'd like to say before we part?
Yes, I'm sorry to add it at the tail end. I understood there was a possible security breach with the SBA's emergency loan program, or disaster relief, people filing for disaster relief. If you could get back to me on that, that would be wonderful.
Yeah, that would be the first I've heard of that, Betty Ann, so we'll look into it.
Okay.
We can follow up.
If somebody gives me a call real quick, I can share the information that I have.
Yeah, obviously we will work with you to find out about that and see if that's the case or not. Okay.
Thanks, Betty Ann.
Thank you.
Anything else from anyone else on the call? Leanne, I'd be looking to you. You haven't had anything that you popped in with, and I want to make sure you have the chance before we end this.
No, actually, it's been really educational for me just to sit in and listen to everything going on. Fortunately, like we're a real small company or whatever, there's only about 6 of us that work there. And Tom has been able to keep us on the payroll and allow us to work from home, which has been really beneficial. But then I just worry about like the days ahead as far as the company goes. And, a lot of the projects for construction and engineering have been put on hold for a couple of months due to the coronavirus. And I'm just sort of keeping my eyes and ears open, to protect the company in the days ahead, in case this goes on for an indefinite period of time.
Yeah, I'll say that's where our position is here at the Chamber too. We're fortunate to be able to have our team working remotely. But I think those are the things we'll be watching for. Jared, if you've got a crystal ball or more words that you could offer, I think we're all in that boat together, and you can count on us to be getting information out as we learn it. Jared,
Yeah,
thoughts?
look, let me just say, and there, it would be irresponsible, I think, to try and tell you some kind of timeline. But I do think that policymakers recognize that there is a balance to be found here. In conversations I've had in the last week with economists, with epidemiologists, virologists, of all types, people recognize that there is a balance in regards to the interventions we're taking to address COVID-19 and the economic damage. At what point are we doing more actual health damage because of economic crisis than we are good because of the intervention steps? And I would say we're not there yet. And a lot of what's going on right now is trying to buy time to gather real data and information about the virus and how we can best address it. I think some people are fearful that this could go on for 6 months, for 12 months, and others are hearing, well, we should just open back up in 2 weeks. And in fact, I think leaders need to be saying, we don't know yet, but we are well aware of this very delicate balance. I talked earlier about this being like a tourniquet on a limb, and we don't want to lose the limb. We are searching to find that right balance. And I think that the way that our public health systems are built are largely regionalized and operate mostly at the state and local level. So I think that the governor's administration is doing a good job here in Maine, and that they're going to make Maine-based decisions, and they're obviously just as concerned about the business impact as you all are. So I think
Thanks,
people are going to try to loosen up restrictions as soon as we safely can. But if we get it wrong and have more cases than we need to, more infections than necessary, or if it comes back because we let up too soon, it could be just as economically damaging or prolong the economic damage more than necessary. So we're in this now, and we got to try and get it right.
Thanks, Jared.
Thank you.
Thanks, Leanne, for that question, because I think it's where a lot of people's thinking is at. I just want to thank you for your time. Thanks to your staff, particularly Kathy, who's been a rock star getting this set up and staying in communication with us. And thank you for being a public servant in a time that's not easy. Take care of yourself and be safe while you're down there in DC.
Well, you all be safe too. And thank you so much.
Yeah, thank you. Have a great day, everyone.
Bye-bye.
Bye.